The Treatment Action Campaign will lead a march in the Dr. Kenneth Kaunda region in the northwest to demand that people living with HIV urgently get longer supplies of ARVs. In South Africa, more than 2 million people live with HIV and they are still not on life-saving treatment, with many having started on treatment and then having stopped. Newsroom Africa's Rafilwe Sibuku joins us now. Rafilwe, good morning to you. Again, it brings focus into a story that has been with us for the longest time, with South Africa's high rates of HIV infections and interventions to bring it under control, but also to provide much needed treatment for those who do have HIV. What's the scene? What's the picture where you are?
The picture where we are at the moment, Iman, we are seeing different people that are gathered here. They say that it's the members of the TAC. This is in relation to the march that is expected to happen any minute now. They're preparing themselves. But let's speak to Anele. He is the General Secretary of Treatment Action Campaign, to talk to us about today's march. Thank you so much, Anele, and welcome to Newsroom Africa. Talk to us about what is happening here today.
Today, as TAC, we are gathered here. We are marching to the district office. The reason we are marching is because we want to call upon the district health management of Dr. Kenneth Kaunda to speed up the rollout of the 3 multi-month dispensing of medication for people living with HIV, because that is in line with the new antiretroviral clinical guidelines, which says all people living with HIV and who are stable on treatment, they must be initiated on a 3-month supply of medication in order for them not to keep on frequenting our health facilities, but also as part of decongesting our clinics. And also on top of that, it will assist on people living with HIV to adhere on treatment. But the problem we have, this district is not doing well with regards to that, and we have seen other districts from other provinces which have already started this program and they are at 80%, and this district is still lagging behind. It is still below 20% of those people.
And what is it that you have found out when you're saying that district, Dr. Kenneth Kaunda district, it's lacking, and what is it that you've picked up based on your investigations or the information that you have as Treatment Action Campaign?
What we have picked up is that people living with HIV are still given 1 month supply of antiretroviral treatment, which makes them to go to the health facilities every month, and that contributes to facilities being congested. And on top of that, it therefore means if one is missing their appointment to collect medicines on that particular month, they might not get those medicines. That if people are given 3 months supply of antiretroviral treatment, it will therefore mean people will only go to their clinics to collect medicines 4 times a year. But now, one of the contributing factors which makes our clinics to be congested is because people keeps on going to these clinics and they experience long queues, and at times they wake up as early as 6 a.m. and they will only leave a clinic around 2. So it also contributes to people not adhering to treatment. Yet if they are initiated on 3 months dispensing of medication, people will be able to adhere to their treatment, and they will know to say they don't have to wake up every morning, every month to queue in those long lines in clinics.
And are there those that you had been able to engage with that says we have defaulted on treatment, defaulted on the treatment because they have not been able to go back to clinics on time?
There are a number of contributing factors which makes people living with HIV, sex workers, people who are using drugs, the lesbians, gays, bisexual and transgender communities, which makes them to default. Because one, if you miss your appointment to collect your ARVs or any kind of medication and you go the following day to the clinic, you will be made to stand right at the back of the queue. But also, people living with HIV, TB and other key populations, they still experience stigma and other violations of their rights when they go to clinics, which contributes to people disengaging from care. So as means to cap that it is important that people are given 3 months supply of medication, and also there is a program which is called CCMDD, where there are external pickup points in order for people to go and collect their medication there. These are the things which we want to see in order for South Africa to be able to meet the second and the third 95, because currently South Africa is not doing well on retention to care and adherence. And these issues that I've just raised is what contributes to the country not being able to meet the second and the third 95.
How effective, Anele, do you think that your call would be when we are looking in cases of stockouts of medication, shortage of medication that we sometimes experience in the facilities?
It therefore means when the government took this decision, among other things which they committed they will do, there will be enough stock availability at provincial, at district level, at depot level, in order for them to be able to meet the demand of the supply. So it therefore means if you take those people who are stable on treatment and you give them a 3-month supply, you will be left with those who are newly initiated, and maybe they will be able to meet the requirements. But also there are a lot of contributing factors to the issue of shortage of medicines and medical stockouts, which includes non-availability of medicines from the depot level, but also we have seen in some provinces where some healthcare workers have been arrested for stealing ARVs. So these are the things which we are trying to curb. But also at the end, it must be about the user of the healthcare services being able to have enough life-saving medicines, because when people living with HIV go for more than 2 days without taking their treatment, it therefore means when they go back, chances of those people developing resistance is very high. That's why we are saying those who are stable must be initiated on a 3-month supply, because it is within the policy of the government.
Do you believe that your call will be yielded to and you're going to get a positive response as you are handing over that to the district office?
We believe that our call will be heeded too, because what we are demanding is not something which is coming from our heads. It is something which is in a policy of the National Department of Health. So if they don't heed to the call, it will therefore mean this district is not adhering to the instructions and the policy of the National Department of Health. It is against that reason we are here to put pressure on them to heed to that call and be able to produce data and statistics of how many people who have been initiated on the 3-month supply of medication.
Thank you so much for your time.
Thank you, sister.
That is General Secretary of Treatment Action Campaign, Anele Nayawa. Let me just move out of short, Iman, just so that you can see that the people that are here yielding to that call, that this much is indeed important. You remember that Anele touched on issue of some of the challenges that they are still there in relation to the stigma and victimization and discrimination that happens when patients need to go to healthcare facilities to get their treatment. But also, this much is also to ensure that patients don't get to default on their medication, and they're hoping that they will be their call will be yielded to, because this is something that is already there and that needs to be implemented so that patients don't need to struggle in terms of getting their medicines.
Important issues there where Refilwe Sibuku is joining us from. This is the Dr. Kenneth Kaunda region in the Northwest.